Having talked about the different endocrinal conditions that can give rise to the neuropsychiatric complications, ranging from the thyroidal diseases that have their own thyrotoxic storm-like conditions, and then we have the myxedema madness that was observed in these abnormalities due to the thyroid hormone. And then on the other hand, we have another important gland that we've already discussed, known as the adrenal gland, which has its own manifestations due to the cortisol secretion, ranging from the depressive episodes, ranging from the bipolar affective disorders. Then we have the symptoms such as anxiety and the panic disorders that are quite frequently observed in these individuals. Another important gland, which is known as the pituitary gland, which is situated in the sella turcica in the anterior cranial fossa. That is basically the master gland that is present in the body. So it's basically going to affect a lot of systems of the bodily functions. Any hypersecretion or any hyposecretion of this pituitary gland can lead to a typical clinical picture that is observed in these individuals. The hyperpituitarism basically presents a picture which is known as acromegaly that is observed in these individuals. Usually this condition is also known as gigantism, which is observed in these individuals. So over here in this section, we're going to compare this condition of acromegaly known as gigantism with another condition known as hypopituitarism, and this condition is also named as dwarfism. So these are the two extremities due to the hypo and the hypersecretion of the pituitary gland. And again, there is going to be the neuropsychiatric manifestations of this condition. The clinical picture is going to be there, the typical picture of a giant, the typical picture of a dwarf, and then it is going to be coupled along with the neuropsychiatric manifestations that are observed in these individuals suffering from acromegaly or suffering from hypopituitarism. So there are a lot of causative factors for the development of hypopituitarism. It can be post-traumatic. So one of the causes of the hypopituitarism is the post-traumatic hypopituitarism, birth defects or any trauma that was relating to the birth is going to affect the pituitary gland, and again it can present as a picture of hypopituitarism in these individuals. There are going to be a lot of neuropsychiatric manifestations that are observed in these individuals, and we'll be discussing them accordingly in the sections of the acromegaly and hypopituitarism. Then we're going to discuss the treatment guidelines for these conditions, and then the hypopituitarism specifically will be focusing on this condition. What are the treatment modalities and how do we basically manage a case of hypopituitarism over here? We'll be discussing that over here in this very fifth and the final section. Now, when we discuss the neuropsychiatric complications, it basically consists of an increased lifetime rates of the affective disorders. So the mood disorders, they are quite frequent, they are quite prevalent in these individuals, and this is sometimes coupled up with especially major depression and dysthymia. Dysthymia is basically an altered mood state. So this is not going to be, the mood is not going to be of a stable kind. It's going to be a dysthymia that is observed in these individuals, ranging from an elated mood and one time and a depressed mood on the other hand. So these are the range of mood disorders that is observed in these individuals, not anxiety disorders which persisted even after the curative surgeries. So this is going to be again very important, that these anxiety disorders are sometimes they persist even after the curative surgeries that are performed on the pituitary gland. Sometimes these interventions are needed along with the other antipsychotic therapies that are given to these patients, and these mood disorders are sometimes not treated or not treatable in such cases of the acromegaly. The treatment sometimes consists of octreotide. There are a few side effects that are observed with this drug. According to the package insert, cause the depressive symptoms in 1 to 4% of the patients, may cause anxiety, decreased libido. Libido is basically consisting of the sexual dysfunctioning of the person. So the depression is going to be present, the panic along with the anxiety, along with the decreased sexual dysfunctioning that is observed in these individuals that are suffering from hyperpituitarism and are being treated by octreotide, the side effects would include all of these factors that we have to consider in this patient. Then these patients can also suffer from paranoia. It can be the delusions of paranoia, it can be any persecutory delusions that the person can be suffering from, and then he or she may also suffer from amnesia, that is, it can be an anterograde or a retrograde amnesia. That can be observed in these individuals. Recent memories cannot be stored or cannot be formed. It's again one of the manifestations that is observed with this drug, which is known as octreotide. Now, moving on to hypopituitarism, the risk of patients developing hypopituitarism, it's most common sign of pituitary impairment. Growth hormone deficiency is one of the factors that is quite frequently observed in these individuals who are basically suffering from hypopituitarism. So usually this condition is going to be characterized by this dwarfism that is observed in these individuals. The facial features would include an increased frontal bossing in these individuals. Then we have a brow furrow that is observed quite frequently in these individuals, the enlargement of the base of the nose, the thickening of the nasolabial sulcus, and then we can have the thickening of the lips, parotid hypertrophies, loss of the ovifacial features, and the worsening of the prognathism. So prognathism is one of the features that was also observed in any states, whether it is the acromegaly or the hypopituitarism. There's going to be a worsening of this prognathism that is observed in these individuals. So the treatment modalities would consist of the psychotropic agents such as the antidepressants for depression. So one of the treatment modalities over here is the antidepressants that can be given to these patients of hypopituitarism because they are going to suffer from these depressive episodes or the alternating depressive and the manic episodes. The anxiolytics for if the patient is suffering from anxiety, on the other hand, anxiolytics can also be given to such a patient. Antipsychotics for psychosis, obviously antipsychotics would include risperidone, and then we have the atypical antipsychotics ranging from the olanzapine, bromocriptine. All of these can also be considered in such a patient, suggested only for the correction of the endocrinal abnormalities. So this is the treatment guideline. Obviously, treating the psychiatric condition is not the mainstay over here. We're going to treat the underlying cause, that is basically the hypo or the hypopituitarism in these conditions. May it be the surgical interventions that are needed in this case, because treating the underlying cause is the mainstay when you have a patient of hyper or hypopituitarism at your hand. So the other symptoms would include the amotivation and dysphoria that is quite frequently observed in these individuals. So there's going to be an anhedonia, there's going to be an anergia, agnosia that is observed in these individuals. Obviously, they're going to suffer from these depressive episodes. All of these are basically the signs of severe depression that are observed in these individuals. There's going to be seen a disturbed sleep pattern, and that is going to be coupled up along with the personality changes in these individuals. Obviously, the frontal lobe is affected in all of these individuals. The affective, blunting, auditory, visual hallucinations, they're going to be seen in these individuals. The hallucinations can also range from the tactile, the visual, or the auditory type in these individuals. The cognitive impairment is characterized by the confusional states of delirium and dementia that is quite frequently observed in these individuals. And then on the other hand, we have the visual as well as the verbal memory impairment. So the apraxia, all of these conditions that are associated with verbal memory impairment that are going to be seen in these individuals who are suffering from hypopituitarism. Then on the other hand, we have the post-traumatic hypopituitarism that is observed in a lot of individuals. In these individuals, they usually suffer from mild to moderate depression, and they can also suffer from scales reflecting the somatization. Usually, they will have their physical effects along with the psychiatric illnesses. That is basically known as the method of somatization. The paranoid ideation were inversely correlated with pituitary hormone levels. So, the paranoid ideation is going to rise if we have the low pituitary hormones, and if we have the high pituitary hormones, the paranoid hallucinations are going to be on the underground levels. So this is the inverse relation of the paranoid ideations with the pituitary hormone levels that we usually encompass. So in this section, basically, we summarize this condition of hyper and hypopituitarism. We had a comparative study of hyper and hypopituitarism and what are the different treatment modalities that can be associated with them. And on the other hand, what are the neuropsychiatric complications that are seen particularly in these patients of hyper or hypopituitarism. So that is the end of this section. Thank you for watching sqadia.com.